Meanwhile, there are growing concerns tonight over the future of home health care here in Ohio. 5 on your side, Chief Investigator Ron Regan with us tonight. Ron, this could hit low-income families the hardest.
Well, 1 in 4 Ohioans receive their health insurance through Medicaid, but the COVID-19 crisis is cutting into the state budget. There are as many as 700 home health agencies across Ohio providing skilled nursing care. Megan COFFY goes into clients' homes every day.
We're it for some of these clients. We are the only people that are going in to see them. So it's a reassurance for them.
While her agency has secured the masks and gloves needed for protection, many others still, months into the crisis, have not.
Some companies cannot get the supplies that they need to protect themselves and the patient. And that's a real big concern right now.
And even though federal CARES Act funding has set aside $50 billion for home health agencies nationwide, terms and conditions must be met and tax documents provided before agencies receive a penny. Plus, Medicaid reimbursement rates have not gone up for years, forcing agencies to subsidize increasing costs like salaries. Joe Russell heads up the association representing Ohio's home health care industry.
And so what concerns me most is that, we're facing a situation where we could be at the beginning of the end for Medicaid home health,
forcing many to go without services. Meanwhile, Ohio has already announced $210 million in Medicaid cuts, and the industry is bracing for even more next year that could impact services. Greg Davis operates a home health agency that's not at risk, but he's spoken with others around the state
that are really on thin ice at this point. So they could feasibly go under this month or in the coming months.
Well, it's a stark reality that home health care agencies can make 3 times as much money from Medicare patients than Medicaid, which serves low-income families and children for the very same services. I'm Chief Investigator Ron Regan.